The kind of confusing points, and we'll go over them again. So this is what we call the T-bar. This is the cervical, this is the T-bar where the patient will put their arms, and it just helps them to get more traction. There's a little lever right here next to the T-bar. Everybody always wants to squeeze that, but you don't squeeze it. You actually pull it away. So you push laterally on that lever for the T-bar to pull it out. Actually, to pull it out, you don't need the lever at all. But to put it back in, you do need the lever, and there you go. Sometimes students will struggle with this bar because they want to pull it out using the handle. It doesn't work. This is metal inside of a little metal piece, and you really have to be square to it in the middle to make it move. And so they'll do the same thing trying to push it in with the handlebar. You push in the middle, it'll push in. All right, this table has a cervical drop. The cervical drop is right here. You can see that when the drop is activated, it comes up and back. So when the drop falls, it actually goes anterior and superior.
Nice.
So you get a little bit of positive fly with it. All of the levers that have the little rubber on them, the rubber piece or the plastic knob, those are all the drops. So when you get in here and you start going, ooh, which one's the drop? It's the one with the plastic on it. When you're down here and you don't know because there's this other metal without the plastic on it, it's the one with the plastic on it is the drop. So here the drop, you can see it comes up like this. So it pivots at the caudal end. And so this doesn't do you much good to put a segment here and use the drop because it doesn't really fall, right? Because it comes up and it falls like this. So nothing much happening here. This is I call this the dinner triangle. You see it, it's a metal triangle. And I call it the dinner triangle because it lowers the head to the trough. So you'll never forget it. The idea is that you never forget it. That's the idea. So that is for flexion. This table actually it'll go 40 degrees up, 20 degrees down. Well, I didn't show them that yesterday, but this is really good for side posture. I've showed some of you guys in here.
Yeah, you showed us a few weeks ago. Well, actually, I think that was like the second week.
Mm-hmm.
Wow, that was a long time ago, actually.
Yeah. That was 6 weeks ago, right? All right, so we do want the headpiece in about 10 to 15 degrees of flexion for our patient. We have two little handles right here. You don't have to squeeze them both. You only need one, and this is how you can steer your rocket ship. It does pivot down here, so when people are trying to make it move here, it doesn't move there. It's only going to pivot down here. And this one doesn't kind of take itself back to midline. So whenever you bring it back to midline, you have to kind of pay attention, and you don't want to, not get it quite there. All right, so thoracic drop. This is the pelvic drop. It does that same pivot thing, but that's okay because we're not going to have any of their spine all the way down there. This other little lever here that does not have the plastic on it is for the abdominal release. And this is the main difference between Leander and Cox technique, is that Leander proposed flexion distraction from a more normal lordosis. So I don't like this. I have a spondy. Mm-hmm. If you don't like it, leave it up. If your patient doesn't like it, leave it up. And you don't need to use the lever to let it come back up, as long as there's weight on it. So if you go and lift this lever and there's no weight on it, you actually disengage the entire lever and we kind of have to put it back together. So, which usually is easy, but not always. So if you come up and hit the lever without somebody on it, it'll do that. Now my whole little thing is undone. And actually these, I think it's been done so much that these bars are almost eaten through. So as long as there's weight on it, oh, it's not locked there, it's locked now. As long as there's weight on it, when you lift it, it'll go down. And then you don't have to do anything, just when they get up, it'll come up. Mm-hmm. It can be a little bit hard if somebody's kind of heavy and they're laying on there. So if somebody's on there and I'm having a hard time getting it to release, I'll just have them say, lift up your pelvis a little bit, and then I can get it to move. So drop, abdominal release. That's most of that. Then I was showing some of you guys these levers down at the end. You guys kind of watched you play with them a little bit. Mm-hmm. So this top one, these are the ones I remember they're backwards because I have to push down on this top one to lift the table. and that it's a little weird. A lot of times, the first couple times you do it, somebody squeezes it and they're like, oh, and kind of drops the table. It happens. And then the bottom one, there's one under this bar, and that's to pull out the ankle piece. We have 2 foot switches, a green and a red. That's for starting and stopping the table. And the other table is to raise and lower the table. So where I was showing you guys that it'll go into more flexion as it races, well, it goes into more extension as you lower it. So you would probably kind of want to figure out your table height before you put the patient on the table, or you end up doing a whole lot of stuff with the legs down here. So if I did need to lower the table and I wanted it that low, again, I would just stop it at the top of its motion, and then I would level out the table. And then I was showing some of you guys, if I have legs on here and it's heavy, I'd like to brace my elbow on my knee to operate this lever. It kind of helps keep me from having that sudden jolt of all that weight, which doesn't feel great on your back. All right. That is, oh, I almost forgot. If the timer's not on, none of your tables will turn on, even if you hit the green switch. So there's a little timer on the side, it's white, and then the little black knob is for the table speed. So you can speed up and slow down the table as well. So I'm gonna go ahead and raise it. Who's gonna be a patient? This is the best day to be a patient.
Yeah.